Good evening. You are welcome to Let's Talk About, our Wednesday evening program that is purely the program hosted by Trinity United Church, but for everyone to tune in, to listen and watch. You can watch us live on our YouTube and Facebook channel when you type in Trinity United Church Legon into YouTube and Facebook. And then you can send your questions and comments to our WhatsApp number 050-157-9996. My name is Joyce Chumesiedu, and I fellowship here at Trinity United Church, Legon. For tonight, Let's Talk About program, our topic is infertility or childlessness. And with us this evening, we have a very seasoned obstetrician gynecologist by name Professor Kobina Ncheche. He's an associate professor of the University of Ghana Medical School, and he's a consultant with the Obs and Gynae department at Kolebu Teaching Hospital. Prof, you're welcome.
Thank you very much.
Before we started, I was asking Prof how many years of experience he had in delivering babies. And he said, okay, so since 81, so that's like 41 years. And I'm like, then you've seen thousands and thousands of babies delivered, seen as you are at Kolebu. And Prof says, oh, I've even gone past that. Now I'm delivering children that I delivered. So he's like second and third generation babies. Wonderful. So I mean, that goes to tell us that we have a very seasoned person to deal with today's topic. Then again, as part of the panel, we have Mrs. Jana Say Tutu. Jana fellowships at Trinity United Church, and she's been so gracious to be on the panel today to give us her life experience of the years that she faced infertility, what she went through. And I am sure that her testimonies and experiences would be very insightful and would give some other women experiencing this condition hope. So, Prof and Joanna, you are welcome to Let's Talk About.
Thank you very
Thank
much.
you very much.
Prof, we'll start with you. For this program, viewers, again, it's going to be in two parts. For tonight, we are going to concentrate on the medical aspects of infertility or childlessness. And then next week, God willing, we'll look at the social part. So that is why we have Prof Ncheche with us tonight to give us basically the medical aspects of infertility. So Prof, without much ado, start with you. What do we mean by infertility or childlessness? What is this all about?
Yeah. Right, thank you very much. As I indicated earlier on, I prefer the term infertility to childlessness because I think childlessness is rather stigmatizing. But when we talk about infertility, we mean inability of a couple to achieve pregnancy after a year of regular, unprotected sexual intercourse. If the woman is 35 years or older, then would take 6 months instead of 1 year. But basically, that is the definition of infertility as we apply it in practice.
Okay. Prof, is that to say that if a couple comes to you, say 3 months after their wedding, and they have been having regular intercourse, in fact, at this juncture, I even want to ask you, if you say regular, what do you mean? As in 3 times a day?
Oh, right. I'm not sure anybody has the capacity to do it 3 times a day, but about every 2 or 3 days, okay. Yeah, you know, should be okay. Yeah, okay. And the situation you were trying to portray if somebody came after 3 months complaining that she had been trying to not getting pregnant. Well, first of all, we'd ask a few questions to make sure that the periods are regular, you know, and that there isn't anything to worry about. And then we just tell them, please go and continue whatever you are doing. If after 1 year nothing has happened, then you come back. And in a lot of cases, by the time the year is up, you find that if there was no problem, they will get pregnant.
But then if the lady is 35 years and above, you reduce it to 6 months.
Yeah.
Okay. Why would you do that?
Oh, because we know that from that age onwards, you know, there's quite significant reduction in the woman's fertility. So we don't want to wait for too long before, if we needed to do something, we did it. Yeah.
But Prof, I'm wondering, why is it easy for some? Because some get pregnant honeymoon, first night, and it happens. Some would have to try and try and try. What is it? Is it something that the woman is not doing right, or the man is not doing right, or what is it?
I mean, it's sometimes difficult to explain. It takes only one act of sexual intercourse to get pregnant, and yet we know that some people have to try several times before they get there. But it all the point is that we're all different. We're all different, and so while for some it just happens, for others it takes a bit more time.
I see. So then what can cause infertility?
I think that we have to understand that pregnancy takes two people, the man and the woman. So if there is difficulty in achieving pregnancy, then the problem could be with either of them or even both of them. And sometimes we have what we call unexplained infertility. All investigations will be done, but nothing will be found to be the cause. But we have causes in the woman, and then we have causes in the man. As far as the woman is concerned, you know, sometimes there's a problem with ovulation. That is the process of producing eggs. And when the eggs are produced, they have to pass through the tubes towards the womb, because the sperms meet the eggs in the tube, fertilize the eggs, and then the eggs move down into the womb itself. So sometimes there's a problem with producing eggs. Sometimes the tubes may be damaged, usually because of pelvic infection. Or there may be a problem with the womb itself, either the woman has got huge fibroids and therefore making pregnancy difficult. And then, again with the woman, there can be other hormone problems. For example, if you have a problem with your thyroid, it can give rise to infertility. Then with the men, the main issue is inadequate numbers of sperm in the semen. Because even though only one sperm fertilizes the egg, normally there should be millions of sperm in a spoonful. A spoonful is even in a milliliter of at least 20 million. That's the minimum that we talk about. And sometimes the numbers may not be adequate, either because the testes which produce the sperms are not functioning adequately, or the tubes that carry the sperm to where they should be may be blocked, you know. And so for a situation like this with any couple, we have to try and find out what is the problem. Okay. And there are various ways in which we can do that.
Okay. So then, Prof, would you say, I don't know, would you advise that before you get married, you should visit a gynae to make sure that you are okay before you even go into marriage? Is that an advisable thing to do?
No amount of tests would assure you that you can get, you can do all the tests and everything may be normal, but it doesn't mean that when you get there, it will happen. The surest way to do it is to try it, and that can only happen after you are married.
Yes.
Yeah. So I remember some years back, a young doctor lady came to see me. She was going to get married and wanted me to do various things to find out whether she could get pregnant. I just told her, look, go get married and get on with it. If there is no pregnancy, we'll sort it out. Of course, she got married and got pregnant. So because you can have all the tests done and which show that everything is normal, but this may not necessarily mean that when the two of you get together, it will happen. So the surest way to do it, to find out, is to do it. And that can only happen after you get married.
Yeah. Okay. Prof, let me give you a breather. Joanna, okay, so at what point did you realize that, no, I'm becoming childless, looks like I have issues with infertility, so let me get on with it? At what point did you start becoming wild?
Wild. I don't think I was wild in the sense of the word. I didn't go crazy, but I always knew I had issues with my menstrual cycle. So I was a very, very early bloomer. I started menstruating when I was 10. I realized very early that it was very irregular. So as early as my mid-teens, my mom started taking me to a gynae. So I was visiting a gynecologist quite early to try and regularize, for lack of a better word, my cycle. And I remember after...
So your menstrual cycle was, as in, you were not
so I could
having your
I
menses
could go
every month?
I could go 4 months, 6 months without a period, and that was it began 30 days. I would then, most people say, oh, I'm 28 days now, my period will come. I never had that. I never had that blessing.
Regular.
Yes, so I could go 30 days, 41 days, 50 days. So that was me. So secondary school, I'll be there, and then it will come. And when it came, it was heavy, it was painful. I'll go to a sick bay, I'll get painkillers. So I started very early seeing a gynecologist to manage the pain, so that I could function the first 2 days of my cycle. University was the same thing, but I was in school, so I could always skip a day of lectures, just sleep it off. But when I started working, it was irritating because I could go 3 months, 4 months, and then one day in the office, I realized I've sold myself and I'm stuck in my chair. So again, I went to see my gynecologist, and I think I'm one of the few people who was put on birth control to regulate my cycle.
Oh, birth control?
Yes. So
even before you got married?
Yes, married. So I was put on birth control to regulate my cycle. At least it gave me a semblance of when to expect my period. So at least I knew when my period would start, and I could manage the pain better. So I'll take a painkiller the day before it was supposed to start, so that it gave me some semblance of a cycle.
Okay.
So it didn't really cause me to think there was a problem. I just knew I had a very irregular menstrual cycle. So we got married. Pregnancy wasn't a thing in our plans for the first 2 years of marriage.
Okay.
So again, normal. I was still on a pill, not because of birth control, but because it was to regulate
your
my menstrual cycle. Then after 2 years, we said, okay, we are ready to start a family. So I think 6 months before we're ready to start, I told myself I'll go off it, so give my body time to go off the pill and everything, because it's a birth control. So definitely my system had gotten used to its purposes. So I gave myself 6 months to wean myself off the birth control and get my system regularized, which was what a birth control does anyway. So after 6 months of, as Prof would say, regular activities, I realized that by now,
it should be happening.
Or at least now my system is back to normal,
which
is what most people's system should be. So I think after 9 or so months of the pill, regular activities, I realized that by now, or I felt we should be seeing some signs of either being pregnant or something. So I think after 9 months or so, I told my husband, let's go get check. Let me go get a checkup. I haven't had a pap smear this year. Let me just get a checkup and then also see let me speak to a gynae and see what is up.
Okay, so by that time, it was almost 3 years after wedding.
Just about, yeah.
Okay.
Just
and
about
almost a year of trying.
Yes, I finished school. Have come back from school. Yeah, so just about.
Okay.
So I go into this.
John, please hold it there. Let me ask Prof something I picked from you. Prof, she said that before marriage, even in her teens, she had irregular cycle, and so she was visiting a gynae and she was put on birth control. Now my question is, someone even before marriage taking birth control, would it not affect your system? Would it not cause infertility?
No, see, for her, being prescribed birth control pills was one of the ways of dealing with the problem she had. She had what we call PCOS for short, or polycystic ovarian syndrome. And
polycystic ovarian syndrome. Because that was what was making her menses
with
irregular.
that condition, you don't ovulate regularly. You could go several months without ovulating, and generally it is when you ovulate that you have your period.
Okay. So what's ovulation?
When the egg is released from the ovary, that's what we mean. And because that was not happening, that's how come she could go for some months without a period. And then when she had a period, it was very heavy. So until that problem was solved or resolved somehow, pregnancy was not going to happen. So maybe she would tell us what happened and she got pregnant.
And she got pregnant. Okay, all right. But then back to my question. She being on birth control so she was on birth control for a long time, right? Since your teens?
No, since post-university, so from about 205 to about 4 years.
4 years of take regularly?
Every month.
Every month you take birth control?
Yeah, normally we expect that when you come off it, things will get back to normal.
Okay.
Yeah.
I see.
In most patients, yeah.
Okay. So you wouldn't say for sure that it was because of the birth control?
No, because the birth control was to deal with a problem which would cause infertility anyway.
Yeah.
You know, just that, you see, the way we treat that condition depends upon what the individual wants. If the individual is not ready for pregnancy, then we'll treat in a way that would regularize the menses. Okay. But once the person gets into the situation in which she's ready to have children, then we'll give medicines that will make the ovaries ovulate or produce the eggs. Yeah.
Okay. All right. Okay. So.
So we went to see. I asked around for gynaes, and at that time my old gynae had passed me. He rest in peace. And so I went to see. I was recommended to this top-notch gynae. I walked to his room. I remember it so well. And he asked us, why are we here? And I told him, and he said, but you have PCOS. And I might say to I might say to my head, and I might say, oh God forgive me, it's a check, like, this man is a twerp. I was like, what do you mean? I mean, this is your first time seeing me. If I knew I had PCOS, I would have told you I have PCOS. And he could see on my face
that you didn't know what it was.
And then he said, I was like, what?
What is that?
And he said, but you said you've been seeing gynaes since you were 17, and you seem to know your problem. So after that, he just said, yeah, so since you've gone off the pill, continue having sex to try 3 times a week, and then after that, come and see me again for another 6 months. And then he turned to talk to my husband about medical issues. I'm so serious. So they spoke for another 15-20 minutes on medical issues, and that's where we're leaving. I remember my husband said, yeah, but I have more. Because for me it was very offish. And this was supposed to be one of the most highly recommended gynaes in Accra. But then I went home and I Googled it.
Okay.
And I tried to understand what the condition was and what it was about. And then everything from my childhood made sense. But then I also got pissed with all the gynaes I had seen all my life. Because
who hadn't discussed
who knew what was wrong with me, but had been treating segments of my problem and not telling me the full picture or what was wrong with me. It may not have solved what the problem was at that time, but at least it would have given me a sense of what was wrong with me. It wasn't that I was ill, but then at least I would have had a sense of what my problem was and what was causing my discomforts, my struggles, everything that had. I mean, there were times I remember in the office, I would just get up and
You just pour.
I just pour. I'll go over a speed ramp and. So at least now it made sense the past 27 years of my life, what it was. So then I remember I asked again for another gynecologist because now I was like, this Monday, I'm done. So who else could I speak to? Who else could I talk to? Who would? Because now, okay, so this was the problem. And definitely it could affect my ability to have a child.
Yeah.
And now that we do want to have a child, how do we address the problem? And so I remember we asked a few people. I was asked to see an endocrinologist at Kolebu, and I did that. And then they referred me to another gynae around Tishi, who was slightly more mature in the process, more down to earth, and took his time to explain what the condition was.
Okay.
Asked a bit more family history, asked a bit more questions, and I realized it is a family condition.
Oh.
It can be a bit genetic. So now listening to what he said, seeing my family history, I realized that, yes, some of my siblings, maybe I think my mom had, I think that's another reason why she started so early in getting me to go to see a gynae.
Okay. All right.
Because it seemed to be something that ran with us.
Oh, so Prof, it does run in families,
To
such
some,
a
to
condition.
some extent, yes. yes.
Different symptoms. If we have different symptoms amongst us.
Okay.
Yeah. So then I asked him, so what do we do? What are my options if we do want to have a child in terms of the way forward? And we outlined a few medical processes. Some of them are most uncomfortable of them. One of them was what? HCG.
HSG, hysterosalpingo, X-ray of the womb.
It is one of the most uncomfortable and most painful process any human being should ever endure. But yeah.
So what test is that?
So the doctor.
No, it's you see, we do various tests to try and find out the cause of the infertility.
Okay.
We do tests to find out whether the woman is ovulating.
Which I wasn't.
We do tests to find out whether the tubes are open or patent.
Okay.
And that's one of the ways of doing that is through the womb X-ray. So basically what happens is that you go to the X-ray department. It's usually done a few days after your period has ended. We have a way of injecting, we say it's radio opaque. In other words, X-rays, when X-rays pass through it, it's opaque. So that will show on the film. So that would show the shape and size of the womb, the inside of the womb, whether the tubes are open or not. So that tells us whether your tubes are patent. Because if the tubes are not patent, then it's not, if the tubes are blocked, then it's not possible for the sperm to meet the egg and then fertilize, and then it will travel down. So that's one of the,
I like how Prof has explained it so nicely. It wasn't that nice.
we know that it can be painful.
Oh, Prof.
It can be painful, yeah.
Basically, they push dye into you, into your tube. So yeah, that's what they do.
Yeah. But there are other ways of also determining whether the tubes are patent or not. But you haven't finished your story. So what eventually happened?
Yeah.
So yes, so they did that one, and my tubes were fine. So my tubes were not blocked. I was asked to, again, I wasn't menstruating. So to get me to menstruate, I was put on medication.
So when you stopped with the birth control,
no, I still wasn't menstruating.
Then you went back to your normal
my normal
system.
6 months, 4 months. At times, I think I went a whole year
without menstruating.
Yes. I'm the reason why always is not in business. So to get me to menstruate, for example, for this exam, I will put on medication for a few months, Clomid for a period, and they increase the dosage until I menstruate. And then
But I'm sure they also checked your husband's semen.
he was fine.
Yeah,
Yeah,
okay.
yeah. So his semen was
Because
checked.
that's also one of the tests we do
Yeah.
to find out whether the semen analysis
Yes,
is
so his
normal.
semen was fine. And
So hold it, please. Prof, when you are checking the semen, what are you checking for?
Okay. The volume of the semen,
Okay.
the color. But the more important thing is the number of sperms, the concentration of sperms, whether the sperms move rapidly forward. Because for the sperms to do what they have to do, they have to be able to move.
Yes. But you need just one.
Yes.
Do you need millions of them to be present?
Only one is required, but millions are necessary for
push
that
forward.
to happen.
I see.
So whether the sperms look normal, what we refer to as the morphology of the sperms. So these are all important parameters that are looked at. The concentration of the sperms, the morphology of the sperms, the motility, in other words, and then the viability, what proportion of the sperms are alive. Because you can have sperms, but they may be dead.
They may be dead.
So these are the very
see.
important parameters we look at.
Is
when we
it
look at
possible that a man would have no sperms at all?
It is possible. It is possible, and that may result because the testes produce the sperms.
Okay.
So it's possible that something may have affected the testes that make them unable to produce the sperms. Or the testes may produce the sperms, but the tube that will carry the sperms may, for whatever reason, be blocked. Again, that can be due to some infections.
So the semen will come out all the same,
Yes,
but
because
it will be
the semen
spermless.
is just fluid that carries the sperm. So you can have semen and there may be no sperms in it.
Okay.
Or there may be sperms, but the concentration is very low.
Yeah. So it means that truly fertility is not always a woman's problem.
No.
Because we have instances where the man will say, as for me, I'm okay, I'm ejaculating normally, so the problem must be you.
That's the unfortunate impression that especially some men carry. Even our society, they think that if a couple has a problem of infertility, then it is always the problem with the woman. But it is not the case.
It's not the case.
Yeah.
Okay. All right. Jana. Okay.
yes,
So you did several tests. You did the X-ray of the womb.
I did ovulation tests, so I'll be every month I had to take a test similar to like the.
That's a blood test.
No, I was using the ovulation stick.
Okay,
So
okay,
similar
all
to
right,
like a
okay.
pregnancy stick.
All right.
Okay.
The P stick.
Home
Home test. So I bought a pack of them. So every month I'll test. So after I realized that I wasn't ovulating. So finally, the advice was to then try an IUI, which was to stimulate me enough.
IUI is
Sorry.
intrauterine insemination. They will take the man's sperms, and there's a way of introducing the sperms into the
Woman.
womb.
Okay.
And it usually be done around the time when the woman is expected to ovulate.
Okay.
So instead of through sexual intercourse, you place the sperms directly into the womb.
But Prof, if she's not ovulating, it means she's not releasing an egg
So
to
in
meet
that
the
case,
sperm you are-
if they are going to do that, they should have confirmed that she was ovulating or done something to make her ovulate. I don't know whether that was
Yes.
done.
So basically, I was going in every morning at a specific time for injections.
Okay.
To be stimulated. It was for a period. I think it was for a week and a half. So I chose a time. That's why I chose a clinic that was closer to where I was, so that I'll go in at a specific time every day to be given an injection. That was basically to stimulate me enough for ovulation.
You don't remember the names of the injections? Okay, it's all right.
Okay.
It's all right.
I'm sure I have the boxes somewhere in my house. But the only problem was that because of my PCOS, so what it is when I wish I bought the X-rays. The eggs that I should have released, that never released themselves, they were still attached to my ovaries.
Oh.
So it's like what do you call that thing? A
So
beacon.
like mangoes hanging.
Thank you.
Or you mean on the ultrasound?
Yes.
Yeah,
So
we
you
describe it as a string of pearls.
So you see them attached to my like
That's
a
interesting.
like
John,
little.
can you hold on, please? Let's just take a musical interlude. We'll come back. Viewers, we have been talking to Prof. Kobina Incheche Kolibu and then Mrs. Joanna Osei-Tutu, Trinity United Church. We'll just take a musical interlude so that they can catch their breath, and we'll be back.
Jimmy free, Bonin in Aremu, Seme home, Mommy home to cry. Na me to me, my soul, yeah, na me to me, so. When me uni na mao safaria ese fata chimi me bra ma won't na familia upe mi huni na mao safaria ese fatao shimi me bra na familia
Welcome back, audience. This is Let's Talk About. It's a program that is hosted by Trinity United Church, and we talk about issues that bother us in society, issues that bother us as Christians, issues that bother us as human beings. And tonight we are talking about infertility, the medical aspects of infertility or childlessness. Join us on our social media platforms, Trinity United Church Legon, on YouTube and Facebook. Please start sending your questions and comments and send them to the WhatsApp number 050 157 9996. You could also send them to our Facebook page and on YouTube. So with us tonight, we have Professor Kobina Incheche, Obs and Gynae at Kolebu Teaching Hospital, and Mrs. Joanna Osei-Tutu. She fellowships with us at Trinity United Church, who went through years of infertility and has been kind enough to share her story with us. So, Joanna, before we went on break, you were telling us about IUI as one of the tests that you went through. What is IUI? And Prof was
insemination.
Okay.
And as I was explaining, they take the semen or the sperms and put them directly into the inside of the womb, the cavity of the womb. So then the sperms are supposed to swim, go down the tubes, and then hopefully meet the eggs. Yeah. Okay. And as she was saying, because she was not ovulating, they gave her medicines to make her produce the eggs.
Okay.
But you're explaining why they stopped it.
So why did they, did it work?
No, it didn't. So,
Prof, but then why would they do that? Because the problem was with her ovulation.
Yeah, so that's why they gave her drugs to make her produce the eggs.
Yes.
So that when they did the intrauterine insemination and the eggs were released, then the sperms would fertilize the eggs and then pregnancy would occur. Okay. But the whole process was aborted because, as she was saying, there were too many eggs that had matured. Yeah. And they were worried that she would end up having, high order multiple pregnancies, not just twins, but not triplets, but even quadruplets. That's why he said they aborted it. Okay, so no, let's get that part right. Okay, you were saying that your eggs were hanging on your ovaries.
So the first time they took a scan of my ovaries, you could see some of the eggs that I should have or were supposed to have released, still attached to around my ovaries. Okay. So they said it's a classic case of like the PCOS. So they were still almost like boy. Okay. Yeah. So you could see still them there. So as I was being stimulated, many of them began to mature. Right. So by the second or third scan, they realized that I had more than 15 eggs maturing. So if they continued, I could have about 15 or 20 eggs fully mature by the time they wanted to introduce the semen. And since, as Prof rightly said, you could have by the millimeter 2 million. Or more.
Minimum 20 million per
20 million sperms being introduced. Then if all 20 million are introduced and I have 20 eggs fully matured, there's a
ready to be fertilized.
There's a possibility that all 20 could be fertilized.
Oh, wait.
Although in a natural situation, it's unlikely.
It's unlikely, but the fear is that. Or then, if even 6 or 8 become fertilized, I could be carrying in high numbers of yes.
That would have been dangerous, right, Prof?
Yes, I mean,
supposing she was carrying about 8.
No, that even with that, the chances are that she would have miscarried somewhere along the line, because the higher the number of fetuses you are carrying, the greater the likelihood that the pregnancy would end well before you reach where they should have ended. Yeah.
But Prof, was it not possible that, okay, so supposing she got like 15 fertilized, couldn't they have pulled out some? I don't know how that would have worked.
It's
pack them out.
You see,
and perhaps leave
it's
about
a different
3.
thing when you have IVF. If it were an IVF procedure, they could have harvested those eggs and then fertilized them
outside. The body.
But you can't fertilize the eggs inside the body and then get them out. That's not possible.
Oh, okay.
But you can fertilize the eggs in the laboratory. And usually when they do that, they would examine to find out those which are of the best quality, and then they would introduce. And she said she had IVF as well.
Oh, okay. So when the IUI
was aborted,
became, or the procedure was stopped.
The next option that was given to me was because of the high quantity of eggs that I had. As Prof said, then the best option was to do an IVF. So I was given that option, that I should try an IVF because of the number of eggs that I was potentially going to mature if I was to be, So that was the option that was given to us. So we thought about it, we looked at the options, but the biggest challenge I had with the IVF process was having to, again, be going back and forth to be injected every day, and then it included
every day,
and then you have to go there every day at the same time to be injected, and then after you finish, at that time, now it's different, but at that time, you also had to be, post the insemination, be admitted for 2 weeks.
Okay, please hold.
Post, you see, what they would do is that they will harvest the eggs, fertilize them with the sperm, and then after a few days, they would introduce the embryo into the womb. Isn't that what they did?
And then they would admit you for 2 weeks. And that was what I did. I wasn't enthused about. So I had to look for a clinic that would allow me to, one, take the injections home, so I could inject myself for the period of.
It's done.
Yes.
You can actually inject yourself.
Well,
but what was the essence of the everyday injection? What was it for?
You see, normally during the menstrual cycle, usually only one egg is released. Okay. But when you are doing IVF, you want to have a few more eggs for that purpose. So they give you those medicines so that it will cause more than one egg to grow and develop. Because when they harvest the eggs, you cannot be sure that all of them would be fertilized and be normal.
Okay.
So they harvest the eggs, fertilize them, and then select those that may be of good quality, and then transfer
into her.
But she was talking about the injection. The whole procedure can be very stressful. And I'm sure they explained it to you that it can be a very stressful procedure. And she said she became pregnant, but she lost the pregnancy. And I think that's also something that people need to understand, that the mere fact that you have gone for IVF, it's
no guarantee that
you will be successful. Because for those you hear of with success, there are many others whose were unsuccessful.
So you decided to do the IVF. So every day you were going for the injection.
No,
so
they gave everything to me.
Okay.
So I had to remember the time I took the very first one, and then I had a little ice pack. It had to be cold. So if I was going out, I had the ice pack with me. And then, but it wasn't in Ghana, so I chose a place where I had family. I just also didn't want it around. I wanted away from the environment I was in for a period. So I was around where I had family, and I could stay home. But we had a little ice box, so I had an ice pack on it. So if I was going out, it was a very tiny, like an insulin injection needle. Okay. So it had to be done on my tummy. So if I was out anywhere, I just took a rub my tummy, I injected myself, and it was for 3 weeks. And that was the process of the injection. And then there was timing. So every week I'll go for a review to make sure it was growing, the eggs were maturing, for 3 weeks, did injections, and then the day before the harvesting, there were 2 other injections I had to take before the harvesting was done at different hours, just before the harvesting. Then I went in the morning of the harvesting. I was under anesthesia, so we went in, was given anesthesia. It was taken out. I woke up about an hour or 2 afterwards, and I was told they took out just under 40 eggs.
40 eggs?
Yes.
Which were all matured?
Yes, at that time,
Okay,
yes,
at
40,
that time.
40 eggs.
Okay.
And then I was to come back, it was a Sunday, I was to come back on Tuesday for the, what do you call it?
Embryo transfer.
Embryo transfer.
Okay.
The only problem was when I got to I realized I had a running tummy. So I called the slash, you taking Imodium or something, just treated fluids. By Monday, I realized I had a bit of a bulge, which was, I honestly didn't think much about it. I just slept it off. But by Tuesday, I looked slightly pregnant.
Oh.
A very nice 4 months pregnancy. So I remember I borrowed a relative's attire because none of my clothes
You couldn't fit into
my clothing.
Okay, so please hold. Prof, what was that?
And this was how long after the embryo transfer?
I hadn't had the transfer. I was now going in for the transfer.
So what was the cause of the bulge?
So I went in, and I remember when the gynae saw me, his first question was, when was the last time you used the washroom? And I said, Sunday.
As
And this
in
was
wee-weeing
when?
or
It was
pooping?
Tuesday.
You hadn't weed for...
It just dawned on me that I hadn't
You hadn't
wee-weed
wee-weed.
or poo-pooed.
Oh,
Since
wow.
I called and I complained about the running
tummy. Okay.
Then he immediately asked them to bring me fluids and have me lie down. Then they started doing, you know how doctors become all busy and serious for, and then, but I've been in enough doctor office rooms to know that something serious
was happening.
So after a few minutes,
They
asked,
didn't tell you you had ovarian hyperstimulation?
that was when I heard the statement being made by the doctor to the nurse. So quickly I took my
That's
phone.
what?
I quickly took my phone and Googled it. So I heard a statement. Now, after being with doctors for 5 years of this treatment, I always had my phone next to me, so I Googled it. I remember I talked about the where my eggs had been, all the places that they had been stuck on.
Yeah.
So all those places they took the eggs from, those holes, fluid had filled up in it.
Oh, okay.
And that's why my stomach was bulging.
Prof, would you want to say
Did
something
they still go ahead and do the embryo
No, I
transfer?
didn't.
They didn't.
They didn't do
yeah,
a transfer, no.
because it
They didn't do the
would be
transfer.
unsafe to have done the embryo transfer at that time.
They didn't do the transfer.
But later on, you had the IVF again.
No, so basically the aim now was to get me to release bowel. And it took about, that was a Tuesday. It took me going in every day for fluids, medication until Friday.
You were not weeing all.
By that
so
time,
that's like a week.
I looked 9 months pregnant.
Wow.
And at this point, I realized my breathing I was having challenges breathing because fluids were just building
up.
Yes.
That looks like a bit of a severe form of
Yeah.
that condition.
Yeah. Fluids were just building up, so I couldn't I couldn't lie down well. I lay down sleeping because fluids were just building and building up in me. Yeah.
So, Prof, is that a common complication?
I wouldn't say it's common, but it's a serious complication.
Right.
It's a serious complication of the IVF procedure.
Yeah. So we had to. Yeah, I couldn't do the embryo transfer because of that. But ironically, out of the 40-something mature eggs that they took, only 6 were viable for transfer.
Oh.
So the rest were not.
They were not going.
They were not. So only 6 embryos were viable to be transferred.
Okay.
Yeah.
So then, how did they get you to finally?
Lots of
lose all
fluids. I was on IV. I was on medication. I mean, and by this point, it was just me and because my husband had come back. My parents were freaking out. My in-laws were and of course by this point I had to explain to my family back home what the problem was. My family here too were now getting worried because you could see the stress in which I was in.
You were in.
And yeah, it was stressful for everybody. It was stressful for everybody. So it became a Paibo.
Yeah.
Yeah, and so I remember so clearly that it was a Friday dawn, and I was like, "Erade my bread. I'm done. I'm tired." And I remember so clearly it was a dawn on Friday. I was up sleeping like this, and I just heard clearly, "Sorry, Kojo."
It looks like you had a severe form of the ovarian hyperstimulation.
Yeah. It was just like get up and go. And so I just got up, and that was the first time I remember getting up. And it took a while to get up and roll myself. It's literally like 9 months pregnancy, so you are rolling yourself out of bed. I rolled myself out, and that was the first time I urinated.
And so when you were weeing, did it come plenty?
No, it was a few drops. It was a few like normal, trickle. But by morning,
you had
I started, and then by Saturday, I started having bowel movements.
Oh, okay.
So by Monday, when I went back for my review, my belly had shrunk to 4 months, and by Tuesday, I started going down. Yeah.
These days, you see the injections that are given. I remember you saying that there were 2 others they gave just before. During the time you were having the injections, when they doing ultrasound scans to follow?
They were every week.
So sometimes, depending upon the situation, if the picture suggests that you are likely to have that ovarian hyperstimulation, they won't give
the last 2.
But or they may not even do the transfer because of But these are special treatments that may be used, but as far as the problem you had, the PCOS is concerned, one of the common drugs we use is what, and I think a lot of women know about, clomiphene. But you can still use the injections that were used. We're talking about other causes. If the problem is with the tubes, if the tubes are blocked, then years ago we used to do surgery to try and correct, but these days the outcomes are not too good. So if your tubes are damaged, then usually it's IVF that will be recommended to be done.
But can they blow through? I hear blowing your tubes.
I don't believe in that anyway. I don't think it's an effective way of trying to restore the patency of if the tubes are blocked, they are blocked. I'm not sure much can be done. And the tubes may be blocked usually because of infection.
Okay.
And sometimes somebody may have, if you have fibroids and you're having infertility, it doesn't necessarily mean that is the fibroids are causing the infertility, but if the fibroids are big enough, then you may need to have surgery to deal with it. Other treatments that may be used, especially if the problem is a low sperm count, then they may use, there are situations in which they can take a sperm and inject it into the egg.
One single?
Yes. Trying to simulate what normally happens.
Okay.
So that can be done, especially in situations where the sperm count is very low, or if, for example, if the tube carrying the sperms are blocked, and it's not possible to do anything about it, then they can actually try to extract the sperms from the tube and then use. Sometimes there may be dilated blood vessels around in the scrotum around the testes, and when that happens, that may cause the testes not to function as well as they should. So sometimes the urologist may decide to remove those dilated vessels. And so these are the main ways in which we have talked a lot about the complex ones.
Yeah.
But most of the time, you may be able to use these simple methods to deal with it. But certainly when the tubes are damaged, then you would have to use IVF. We can't even use the intrauterine insemination because if the tubes are blocked, there's no way the eggs
There's
will come.
no way the eggs would come.
Yeah. So that's the, and of course these days, all sorts of things are being done. This IUI we are talking about, sometimes they use donor sperms to do it. Even the IVF, sometimes they may use donor eggs or donor sperms, but these sometimes raise ethical questions everybody will have to.
Because if they use a donor sperm or a donor egg, then who does the child belong to?
Oh, you went in for it. And sometimes, and of course these days, I'm sure you've heard about surrogacy as well.
Yeah.
People getting pregnant for others.
Other people.
You know, these are all some of the options that are available. But as I said, I think that ethical issues are raised, and everyone will have to confront that.
When it comes. Yeah. Okay, so Joanna, at this point, they are not able to do their IVF. So when you came down, I mean, when this condition subsided, did they do the IVF?
After a few months. So
After
I had to wait for the next cycle of people. So they do a cycle. It's a cycle.
Okay.
So I had to wait. This was in February. So I had to wait till August when the next batch of people were going for treatment. Then I was added in onto that batch to go for my transfer.
Okay.
Yes.
So you didn't have to go through the series of injections?
No. What I had to then do was just I had to do some set of injections, but just enough to prepare my system to receive the embryos.
Okay.
So it was, I think, 2 injections and then some tablets and some few.
Because the embryos that they managed to obtain would have been frozen.
Yes, they were frozen.
Yeah.
To preserve them, and then when they needed to use them, then they transferred them into the womb.
I see. So they were transferred.
Yeah,
all
3.
6 of
No,
them.
3.
3 of them.
3 were transferred.
But these days, they even, because you see, you want to avoid having multiple pregnancy
and increasing
So,
the complications.
Yes, so these days 1 or 2.
They transferred 3.
Yeah.
Okay. And then
They transferred 3. I was asked to do a test after 6 weeks, a blood test. So I did a blood test, which came back with a positive test.
oh,
Yeah,
so you were pregnant?
I was pregnant.
Okay.
That's a chemical pregnancy.
Chemical pregnancy.
Yeah.
So the numbers were high enough for it. Then at
If you say chemical pregnancy, what does that mean?
In other words, there's you see, when someone is pregnant, there's a hormone which the pregnancy produces.
Okay.
So the levels of that hormone would go up.
Okay.
So in IVF, they will do that, which would suggest that you are pregnant.
You're pregnant.
But that needs to be confirmed as time goes on, that you actually...
Truly, there's a baby
So there's
in
a
there.
chemical pregnancy, there's chemical evidence that you may be pregnant.
Okay.
Then at 10 weeks, I was asked to do a scan. So I went in for the scan. Yeah, that was in 10 weeks.
And that confirmed the pregnancy.
So at 10 weeks, I went in for the scan. They saw the sac,
Okay, but there was nothing
but
in
the
it.
sac was not big enough to confirm at that period.
Okay.
To confirm what the gynae felt should be the size
Of a 10-week
of
pregnancy.
a 10-week pregnancy for triplets, or for the number of embryos that had been transferred.
Right.
So then he requested I do another blood test, just to look at the numbers again in comparison to the first test I brought in.
Right.
So I went in to do the test again, and then I brought it back. And when I brought that one back, the numbers were 0.
0.
0.
As in?
0.
The pregnancy
I
was
didn't
no
survive.
longer viable.
And the sac was in there. There was the following day, so I did it on Monday. I went in for the scan on Monday. The sac was there. Then Tuesday morning, I did the scan. I went for the test, sorry. I took the test, and the results at 4. Went to the gynae. and it was 0.
So you bled them out?
There was
or-
no bleeding.
Prof, what could have happened?
Oh,
That's
obviously miscarried, but it's surprising that there was no bleeding.
There was no
Yeah.
bleeding.
So then
But
it
of
got
course,
digested in
it
her-
suggests that, at least from what you've said, suggests that the pregnancy, because if you get a sac and there's nothing in it, 10 weeks you should see something in the sac. So it means that the pregnancies were not viable.
So what was the chemical?
Or you could, because the fact that there were sacs, that means that she had become pregnant.
Yeah.
But that the pregnancies, if she became pregnant, the chemical test will show in the early stages. But we need to confirm that there is an ongoing pregnancy. That's why they repeated the scan. But
I see.
yeah.
That's interesting.
So that's, if anybody is going for IVF, they make the effort to make them understand the processes involved, the stresses involved. Because if you don't understand that, you may find it very difficult to handle.
Yeah. I see. So when you were told that the sac was empty, there was no pregnancy, how did you feel?
Oh, I mean, the scan, I could see the screen, so I saw the sac. And I've been doing this I've been going to gynae's office for almost 5 years. So I could read, I had mastered the skill of reading the screen. And so I knew when I saw the sac that something was off. And I could read his face also, so I knew something was off. When I went for the lab in the morning, and then I got the results, I opened it. So before I took it to him, I knew the results. I knew the results in my hands.
And I'm sure you were deeply disappointed.
I was annoyed. I was more annoyed than I was.
For having gone through
I was
all
more annoyed
that.
than I was disappointed. It was. I think that was the end period for me because it was everything medically possible had been done. And that for me was the end. And
of course, I'm sure you paid for it.
Yeah.
It was a lot of money.
Yes.
So that was and I think for me, in the quest for childbirth, or the human quest for childbirth, that was out of that my hand could control. That was the end point. That was the end of the road. So once I opened the first one, I opened the second one. I opened. So once I opened, I saw the 0. I just resealed it. And I took it to him. And I remember when he opened it. Then he looked at the file. He asked, "You came yesterday afternoon?" I said, "Yes." Then he looked at the scan, the picture. And he said, "This was taken yesterday," and I said, "Yes." Then he looked at the results again. And he said, "Let me just take another scan, just to confirm." So then he took another scan, and then he kept. He looked at the scan. He looked at the scan. He looked at the results. Then he looked at the scan. Looked at the scan. Looked at the results, and he said, And then he said, "These things,
They happen.
they happen."
I see. That sounds like a very traumatizing journey for it to get to a point where, I mean, she's like medical. But Prof, is that the end? Excuse me, is that the end? I mean, after this, there was nothing else that could be done. So IVF had failed. She had gone through all these injections and the complications that arose and all that. At this point, was that the end medically of her quest for a child?
Well, the IVF could have been repeated. Could have repeated it. But I think you didn't do it again.
No, I didn't.
Yeah, but some may want to go again to have to see whether it will work, and there's every reason for doing that. I mean, the fact that it has failed on one occasion does not necessarily mean that it will fail again. Yeah, but you didn't go for it.
No.
And you got pregnant naturally.
Yes.
Okay, so hold it. Viewers, could you please keep your comments coming in and your questions? There's a comment by Elizabeth Ousu-Benoit. She says, thanks. Yes, that's my mom. She says, thanks, Prof, for finding time out of your busy schedule to come and enlighten on this controversial issue. Now we know it's not someone somewhere causing the problem. Not the witches in your home. Okay, there's another comment by Joyce Ejipon, and she says, I'm enjoying the discussions. God bless our elders. Okay. So, Joanna.
Let me just come in and say that sometimes a couple may have a problem of infertility just because they are not having adequate intercourse.
Okay.
Maybe the man is working in Aflao and the woman is working in a Lubo. And they see each other once every fortnight. As I like to say, it is a complete waste of time. You know, because they are not having intercourse often enough. Because sometimes they will say, oh, we timed ourselves, and but somehow, even though it takes only one act of sexual intercourse to become pregnant, it just doesn't happen like that.
But Prof, we are told that your ovulation time, a window of about 3 to 4 days, that's when you are likely to get pregnant. So that's when they say you are not safe. All the other days, I mean, you are safe. For those who use the calendar method as their contraceptive or family planning method, they say that it's just about the ovulation time of 3 to 4 days that you are fertile. And so if we live apart and we are able to time, at least that's 1 week, shouldn't that suffice? Must we have it so regularly that even in the safe period?
No, I mean, obviously, if you have the intercourse around the fertile period, there's a greater likelihood of achieving pregnancy. Yeah, that's true. But the point I'm making is that, you know, unless you have the intercourse regularly, you don't seem to give yourself a good chance. I mean, I would usually not tell a couple that have sex at this time unless there is no other alternative, because then it appears as if the whole thing becomes a chore.
Yeah.
You know, but the thing, you're also supposed to enjoy it. You know, and if you ask them that, look, doctor says we should have this thing, this, that, then you are doing it because doctor is saying it. And I think that puts a lot of pressure on the of course, if that's the only way you can handle it, fine. You know, but if the people are living together and they're having regular intercourse, the chances are that they would achieve the pregnancy.
Okay. Prof, I also know that ectopic pregnancy, it sort of reduces your, if you've ever had an ectopic pregnancy, it reduces your chances of, I mean, decreases your fertility.
Yeah, you see, okay, ectopic pregnancy is just, normally the pregnancy is implanted in the inside of the womb, in the cavity of the womb. Now, ectopic pregnancy is one in which the embryo is implanted outside the cavity of the womb, and the commonest place is within the tube. Okay. Quite often, it happens when the tube has been damaged to some extent, commonly by pelvic infection. Now, it is, well, let me put it this way. If one tube has been affected and therefore has developed an ectopic, the chances are that the other tube may also have been affected by the same process that resulted in the one tube being damaged. So when somebody has had an ectopic pregnancy, of course, we remove, if it's in the tube, we remove that tube. Right? Unless, of course, we find it before the tube ruptures. If we find it before the tube ruptures and certain certain conditions are met, then we may be able to treat it with drugs, so that the person won't need surgery. But whatever it is, quite often, what caused the damage to one tube is likely that the other tube could be affected. Of course, there are situations where people who have had ectopic pregnancies have had a tube removed, one tube managed to get pregnant. It happens, quite often. But yes, and actually the mere fact that you've had to have an operation, when we open you up, there's also the risk that you develop adhesions around the other tube that is left. So there's some truth in it, although it doesn't mean that if you've had an ectopic pregnancy, then you can never have a normal pregnancy. But certainly it affects your fertility, because whatever caused the damage to one tube is likely to have caused damage to the other tube as well.
Okay. Prof, I've also heard that growing up, if you have repeated infection, candidiasis, white, as we call it, it affects your fertility. And so when you have white, you must go to the hospital and have it properly treated, because if you have recurring and it's not well treated, it affects fertility.
No, any kind of, you see, okay, we need to differentiate between a vaginal infection, which is confined to the vagina, and infection in the pelvis, which affects the tubes and so on.
Okay.
If you have whites, it doesn't necessarily mean that you have infection in your tubes, because the whites, the candidiasis we call it, it's an infection in the vagina.
Okay.
Of course, those infections may increase the likelihood of other infections going further up. But yes, if you've got those infections, they have to be treated. But vaginal infection is not necessarily the same as the infection that affects the tubes and but as I said, some vaginal infections increase the risk of infections going up into the tubes. Yeah.
Okay. All right. Thank you. There's a comment by Albert Quay. Albert says, thank you. I have a paper on it at TTS. I guess that's a school. God bless you. So Albert is actually writing a paper on infertility. Yes. Oh, Trinity Theological Seminary.
Oh, okay.
That's right. There's another comment by Ruth Redu. She says, Joyce, it's not easy. I also had same problem like John. John, God bless you. I don't want to talk about it. Yeah, so I think, John, thank you. Seriously, you've been very courageous about this. And I think the more people talk about it, whilst others are going through it, then they know that it's not their witch or wizard, it's a medical condition and they can come out. There's, okay, K says, hello, Prof. Ncheche and Mr. Joanna. God bless you. This is very educative and I'm enjoying every bit of it. What are the side effects that comes with the whole IVF procedure? That is cancer, paralysis, and so on. Can you get cancer from IVF?
Well, not really. And as for paralysis, I don't know where it came from. I mean, I don't want to say no. I mean, people have, you see, because the drugs given stimulate the ovaries. Some people are trying to suggest that it could affect the ovaries in terms of cancer, but there's no firm evidence that that is the case. But as for paralysis, it's so far, I've never heard.
Okay, so you can't get paralyzed having had an IV procedure.
The worst complication is what Joanne talked about.
Okay.
The ovarian hyperstimulation syndrome. And basically what happens is that fluid accumulates, and that's why she says you're having difficulty in breathing, because fluid would accumulate in the chest, fluid accumulates in the abdomen.
Wow. So
yes.
Could it have killed her?
Yes, it can, because you see, it shifts fluid from the circulation into other spaces, and I find it difficult to understand why if you're not producing urine, That was, I mean, that's
That's
a very serious
thing. Yeah.
But see, Prof, I realized, and like thinking back on it, I realized the last week of my stimulation process, injecting myself became very difficult because my belly became extremely tense. So I really had to struggle to find.
So you yourself could tell that your tummy had become bigger.
Bigger and harder. So because the earlier days, as I was injecting, the tummy was softer, so I could easily find a spot to inject. But the last week of the stimulation week, it was really difficult to find a spot to inject. So the injection became more painful. But in my mind, it was because of the stimulation process. It was just the stimulation process, all the hormones, and at that time, so I was becoming more moody.
Yeah.
There was a lot of hormones in my system. I was becoming maybe paranoid of what was
Very
happening.
stressful.
So I just took it to be one of the side effects. And then once the extraction was done, everything would
Come back
to normal. Yes.
Okay.
But I remember the last few days before the extraction, my tummy had become extremely tough and tensed. So injection was a little bit more difficult to put the needle through. But
I see.
I didn't think much about it at that time. Yeah.
All right, let's take a break so you can catch your breath. Viewers, we'll take a short break now so that our panelists can just catch their breath.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Hello, viewers. Welcome back. Our panelists, Prof. Kobuna Ncheche from the Obs and Gynae Department, Kolebu Teaching Hospital, and Joanna Say Tutu, Trinity United Church, sharing her experiences. There's a comment by Reverend Dr. Martin Obing, also who says, men, let's be grateful to our women. So it's not only the up and down. And then Kwame asks a question. Kwame says, thank you, Prof, for the education. Can we have a situation where a couple may not be compatible to have children? If yes, what is the explanation? And is there a way of testing before marriage? I think you said that earlier.
Yeah, I mean, should I go ahead and answer?
Yes, please.
No. You see, and sometimes people tell stories of a couple who were not having children. They went their separate ways, and then each of them had a child. The only thing I can think about is, you know, the neck of the womb produces some mucus that is supposed to help the sperm travel up.
Okay.
Now, in some situations, instead of the mucus helping the sperm travel, rather may impede their transport. But even there, if that is really a problem, if that is identified as a problem, there are ways of going around it, rather than saying that we'll go our separate ways. And if we are talking about ourselves as Christians, then what's the other part of the question? I didn't, you know.
Can we have the other part of the question, please? The question was by Kwame. Okay, so while the technical team tried to bring up the question, Jonah, so now IVF failed and you said you weren't going to have it again, but I know you have 2 biological children of your own.
Yes.
So then what happened?
I don't know.
So the IVF failed after, so this is like how many years of marriage?
IVF failed 2013 and we got married 2008.
So that's 5 years.
Yeah.
Is my calculation right?
Yeah.
Okay. So after the 5th year, you didn't have a child and you had gone through all these procedures.
Yeah.
And then you stopped.
I stopped.
You stopped. And then?
And then in March 2014, I had very severe, what I called gastroenteritis. So I had been treating it. I had been given antibiotics. It wasn't going away. Anything I ate, like we thought was gastroenteritis, which. So I remember I remember going to visit my dad.
So sorry, Joanna, at this point you had given up. So between you and your husband, you knew, I mean, that's that.
We had begun the process of adoption.
Oh.
We had gone to social welfare. We had picked up the forms for adoption. We were waiting for them to come and do a home visit. But because of our schedules, they were not getting a good day to come. They wanted to come on a weekday, but weekday was bad for us. So we asked them to come on the weekend. So waiting for the home visit. So the forms had been submitted, waiting for the home visit by the social welfare. So I remember in March, we went to visit my father in Tema. And during lunch, I kept complaining that and everything that goes into my stomach, I was having problems with it. And it was a bit of, it felt like gastroenteritis, which I've had a couple of times. And then he just bursted out, and I went him. And of course, everybody just laughed about it, and we were all like, well. So as we were going home, I remember he said, check it, and we all, okay. And as we were going home, I remember telling my husband that, you know what, this man who has said this thing, he will definitely call and ask us if I have done a test to check about this pregnancy thing. So since I've done a whole set of antibiotics, it's still not going away. And knowing my father who has said this thing, he would definitely ask, have you done the test? So let's just pass the hospital and do a test. At least it will get him off my back. So I remember we went in, asked if the gynae was on duty. They said yes.
Did you go in with hope?
Not really.
It was just to
get my father off my back.
Okay.
It was just to get a story to tell my father when he called later on. So we went in. Ironically, it was the same gynae who I took the lab test to. That was 0.
Okay. He
was the same person on duty that day. So I went in. He saw us and he said, "What's the problem?" I said, "I've been having these problems, and so I want to have a checkup done." And then he was, I think he nearly asked, "I had to go and see a GP. Why are you at a gynae?"
At a gynae.
And so I said, "Well, just in case, I've done all the GP stuff. It's not there, so let's try and see." And then he said, "Okay." So he looked at my file and he said, "Have you done another round of IVF?" And I said, "No." It's okay. So let's just check and see. So he said, let me take a scan. You want to do the P or the scan? Let's just do a scan. It's the fastest way. Let's do the P. So I laid down, and literally I was talking with him about something else. And he was asking about certain things. We're talking, and then I heard the heartbeat.
You heard the boom boom.
I heard the boom boom. And so he looked at me and said, "Have you done another round of IVF?" And I said, "No." And he said, "Well, I found your gastroenteritis."
You're pregnant.
So then we all, literally, Kofi and I just turned and looked at the screen. And he said, "You are about 10 weeks pregnant."
Wow.
And he said, "Okay, my father was right."
And you are taking all these antibiotics?
I had taken a full dose of, I had gone through a full round of antibiotics. I had drank quite a bit that past few months. I won't lie about it. I was like, is the baby okay though? Because it was, yeah, I was 11 weeks pregnant, plus or minus 11 weeks pregnant. I said,
Prof, that could have been dangerous, isn't it?
What do you mean?
Well, okay, so she had taken a full course of antibiotics, because I know that in the first trimester.
It depends upon the antibiotics. Most probably is the type that, even though we would not want a pregnant woman to take certain drugs in the first few months, I mean, they are unlikely. If it were just the common ones we take, they were unlikely to have caused any problems. Yeah.
I see. So, Prof, in as much as you are a medical person, would you say this is a miracle, or it happens?
Oh, it does happen. It does happen. I mean, sometimes, I mean, I've had a situation in which somebody, you know, we do the x-rays to find out the tubes. They say the tubes are blocked. Yeah, blocked. And the person to come back a few months later, it's as if they have thrown tomatoes in your face. She's not pregnant.
Wow.
You know, so some of these things do happen. And I'm happy that everything turned out well. Yeah.
And did you have issues considering all the medications and the procedures you had gone through? This first pregnancy, was it incident-free, or it was a complicated pregnancy?
Oh, so once I got over the shock of the pregnancy,
How did you take it? How did you even get down from the bed?
Being me, I actually bought a pee stick and I went home and peed on it just to confirm it.
Just to be sure.
Yeah, just to be sure.
When you have seen this, I
can be a Thomas at times. And I remember I took a picture of it and then I put it on my family platform.
Okay.
And then my brother called and said, "You're joking, right?"
But they were praying.
And my sister also called and said, "Who is this for?" So in the evening, I remember I told God, I don't want stress. This thing, I don't want stress. So whenever it's over, me and you, we don't want stress. And truly, I was a very stress-free pregnancy. I didn't have nausea.
Wow.
I wasn't vomiting. I didn't have problems with cooking my own food. I carried my pregnancy to the end. I drove myself to the hospital. The only challenge I had was that the baby didn't want to come. So I went 41 and a half weeks. And so I wanted to push, actually. I wanted to have a normal delivery. And at the end, my guy needed to come here. I was like, "Young woman, please, after what we've gone through, let me take this baby out." So I tried. I dragged it until when he was like, "You are losing, the baby is getting too big for the space. You are losing fluid, so let's take her out."
In some situations, after all that you had gone through, wouldn't even have allowed you to have an attempt at delivery.
Yes. So I really struggled with him after 39, when he really wanted me to take it. I was like, "Let me try."
No, but why, after considering all you had gone through, why were you
this
not
is the human
eager
in me
for them to
take it? I guess it was the whole idea of surgery.
Okay.
I didn't want to. The idea of lying in the hospital wasn't something I was fan of. Of the idea of being cut, of lying down, being and that reason why I didn't want to do the first IVF of being. So that was the only. So the CS was the outlier for me. Yeah. And I didn't want to be induced. So if inducement, then I'll take the CS. So I took the CS.
I see. Okay. Okay. So, Prof, Kwame asked the question, and we got lost. So he says, "Thank you, Prof, for the education. Can we have a situation where a couple may not be compatible to have children?"
Well, I think I've dealt with that.
Yes. What's the explanation, and is there a way of testing before marriage?
As for testing before marriage, there's nothing like that. No.
It serves no purpose.
No, it's nothing, so no.
But Prof, you can test before marriage and find you have issues.
The rhesus factor, the blood.
Yes, and then there's also this rhesus factor, and they are saying that you may not be compatible.
If the woman is rhesus negative and the man is rhesus positive, that's where there's a likelihood of a problem. But even there, we have a way of dealing with it.
Okay.
So it's not a big deal.
So it's not a no.
No. The only issue that we're concerned about is where the two of them are carrying the sickle cell gene.
Yeah.
Because if both of them have the trait, we talk about trait when, okay, let me go back. You see, the hemoglobin that we all have, we all have 2 genes for the 2 hemoglobins. The normal adult hemoglobin is hemoglobin A. If you are either AA or AS or AC or SS, if you have AA, then you can marry anybody.
Yeah.
But if you have AS, then you must make sure that you marry an AA. Because if you marry an AS, there's a 1 in 4 chance that any child you have would have the sickle cell disease.
Wow.
So that's the only thing that we would try to caution about. But as for rhesus, it's no big deal.
I see.
Because we have a way of dealing with the problem.
Okay. All right, thank you. A comment by Efo Abrahams. Yes, Efo is a doctor. She furnishes with us. Yes, she says it's very stressful, even for loved ones watching the couple going through these challenges. That's true. It's very stressful. The loved ones who pray and pray and pray, try not to make you feel uncomfortable, yet also wants to show consent. So sometimes you are in the middle somewhere. You don't know if you're not asking is making it seem as if you don't care, or your asking is you are bothering them, you are pressurizing them. You don't even know what to do.
But it's also, it's also for those going through. Because I remember when we lost the pregnancy, having to
the
call,
IVF
the
one.
IV one, having to call to tell them, was a tough one for us.
Yeah. Because everybody was in high expectation.
So I remember the following morning, by 6 a.m., my father was in our house. And I was like, oh, Dad, I think you're even more worried than us. So I think for us also, for the couple themselves, at times you have to, you tend to manage your own emotions because of the people around you. Because he was there at 6 a.m. And he was like, oh, I wanted to see how you people are doing. And I was like, oh, we're okay. We both took the day off. We are home. We are okay. But you could see it really weighed him down. And it weighed down on, I think, our parents and our siblings when the first positive test came out. So then we realized, I realized I had to be a bit more managed in the sharing
of the information.
Because I think for a long time, in sharing information, in telling them what was happening, I didn't take cognizance of how it was affecting those around us.
Those around you.
And those we are taken along on the journey. And then that was where I realized the impact that journey was also having on the inner circle. Because we didn't really tell a lot of people around us. It was just the inner circle around us. It was, I think, when we actually became pregnant, that people outside the inner circle even knew
your challenges.
Our challenges.
Yeah. Okay. I see. There's a comment by Niaduko Abraham. He says, thanks, Prof. Very good education. Really enlightening. Wow, Eno. Well, we call Joanna Eno. She's more known as Eno than Joanna. Technical, can I have Niaduko's? I didn't finish with this. Okay, so whilst you're waiting for them to pull up. So then you had your first one. I
was fine. And then 6 months after her, I was driving to work. And the same gastroenteritis happened again. This time.
After 6 months?
6 months.
Wow.
And that was a shock to me because I was told when you are breastfeeding, when you are the whole breastfeeding process, you can't get pregnant. And again, I think I bled the usual post-delivery bleeding for about less than a month. After that, again, no period. So to me, I was back to my normal lifestyle.
Your normal
lifestyle. And so I genuinely wasn't expecting another pregnancy. To me, I was very content having the one. I was very content. So 6 months, I remember I was driving to work. Then I felt that bitter taste in my mouth, and then that tummy rumble again. And I was 6 months. I remember, so I said that I was like, I think I have gastroenteritis. So on the way back, I passed the clinic again, and that one too, I was 7 weeks. I was 7 weeks pregnant.
Wow. Without having done anything.
That was 7 weeks.
So, Prof, could it? So then, is it a case of she just had to wait?
Oh, I mean, you see, some of these things sometimes they may correct themselves. Yeah, because even though she had not been ovulating, it's possible that as time went on, it happened, and then it happened again. I don't know whether you're still looking forward to another one.
Now at this point, I'm taking precautions. The way things were going after 6 months, 6 months.
Yeah, but you know, so there was a question that was talking about why pregnancy delays or something.
Okay, so let me finish. Nia Duque says, thanks, Prof. Good, very good education, really enlightening. Wow, Eno. God bless you for sharing your story. Okay, all right. There was a question by, yes, I think I saw something from Kay. Okay, so Kay says, thank you, Joanna, for sharing your experience. My question to Prof is, what are the causes of delayed pregnancy or infertility?
Oh, I think we had talked about the causes of infertility.
Yes.
And as far as delayed, it just happens that for some people, for whatever reason, and as I said, sometimes you do various investigations and you find there's no cause, what we call unexplained infertility. And sometimes with time, things, whatever was going on may correct itself. Yeah, so it's just because we are individually different, things may happen differently for different people, you know. So
there's a comment by Patricia Isel. She says, thanks for sharing these experiences. Some of us have gone through a lot. Ruptured, ectopic.
It should actually be you, R-U-P, ruptured.
Right, ruptured, ectopic, miscarriages and all. I believe the Lord will surely come through for us.
Amen.
So, Prof, are there a lot of, reading her comments, looks like there are a lot of women who have infertility issues. Does the statistic
don't say women, a lot of couples.
Couples, yes.
As I was saying, you know, it can be as high as 1 out of every 7 couples may have the problem.
That's high.
Yes, yes.
That's high.
And you know, so that's the issue. And I mean, Joanna has told her story, and I hope it has come through the kind of stresses that had to be. And well, I'm glad you are going to talk about this next time, you know, because I think the social aspect.
Yes. Next week we are going to talk about the social aspects of the stress.
People trying to give you all sorts of advice as to what to do, and you know, and adding to your distress. You know, but I'm sure you will talk about all those.
There's a comment by Cecilia Safo. Mr. Safo says, Joanna, thanks for sharing your experience. I'm sure you are receiving a lot of fans. People are admiring your bravery. But I mean, I think that it should be encouraged when people go through certain experiences and they come out. We should encourage them to talk about it, because then there are a lot more people who are actually in the journey. Yes, and the experiences may help. I am hoping and praying that if there's anybody out there going through these infertility issues, Joanna's story would encourage you, and you would keep hope alive, keep faith alive, and go through it as you should. And I'm sure that the blessings that, I mean, God is one. And the God who blessed Joanna and ended her journey would also end yours. There's a question from Hannah Osman. She says, thanks so much. God bless Sister Joanna and Prof. May I know what thyroid condition has to do with fertility? As Prof, you mentioned
yes,
thyroid.
because the thyroid can either be overactive or underactive.
Okay.
And both conditions do affect the ability of the woman to get pregnant.
What does the thyroid? So your thyroid is somewhere
It's in
here,
the
right?
neck. It's here.
Uh-huh.
And sometimes when it gets enlarged, you can see it.
You can see it. Yeah, like your Adam's apple.
No, this is the Adam's apple.
The Adam's apple is here.
But the thyroid is somewhere there.
Okay.
And it has a very important function to perform. So if it is overactive or underactive, then it affects the woman's fertility.
I see. Okay. There's another comment from Elizabeth Osu-Benoit. She says, Joanna, thank you. Thank God for your life. I must say you are a very brave lady. There's another question. Does the food we eat affect fertility? Is there a correlation
I don't
between...
know how to answer that question.
As in, there's no direct correlation?
Oh, I will have a lot of difficulty saying that there is, what we eat affects our fertility. Apart from eating so much that you become obese, and that will reduce your fertility. Otherwise, I'm not sure there is any food item that when you eat would affect your fertility.
But I know, Prof, I know that ladies who are going through infertility they are encouraged to increase their vitamin E, vitamin K. I don't know how that plays out, but I don't know where I heard it, but I know that sometimes you're even giving
I'm not
supplements.
sure vitamin K is, but okay, sometimes vitamin E, although I personally am not, but certainly if somebody is trying to get pregnant, we ask them just to take folic acid.
Okay.
Because the folic acid has been found to reduce the risk of certain abnormalities that may occur. But
so it's for the sake of preventing certain abnormalities, not to increase your fertility per se.
Well, I'm not sure. No, folic acid not to increase fertility, but even the other drugs you mentioned, I'm not sure they really improve fertility. I'm not sure.
I see.
I know it. They get prescribed. Certainly not vitamin K, but vitamin E. I know.
Okay.
Yeah.
All right. Viewers, as they say, when you're having fun, then time seems to be running. I'm sure this discussion, we can go on and on and on. Next week, God willing, we are going to tackle the social aspects of infertility. What couples who go through infertility have to deal with. We are not going to... Today we've spoken about the medical aspects, what they go through medically. But next week, God willing, we are going to... of your experience without getting emotional. At some point I was afraid you could get emotional. I was praying you would get emotional. Thank you for sticking to it and being able to share your experience. I'm sure that someone out there has been encouraged to keep on the journey, and God willing, the couple might see the end of their journey. Thank you, Prof. Thank you. We couldn't have sought a better Obsengani. Thank you for making time to educate us. Viewers, thank you so much. for being with us, taking with us, and joining us online to have this discussion that is so 1 out of 7 means that it's a very prevalent condition, and so we can't sweep it under the carpet. We need to talk about it and to be able to be there for couples who go through this very traumatic journey. May God help us to be there for such couples, and our prayer is that they would definitely come to the end of this journey. This has been Let's Talk About, a Trinity United Church production, which we have every Wednesday, 7 to 8, to talk about issues that affect us in society, issues that affect us as individuals, issues that affect us as Christians. And my name is Joyce Chumesiedu, and I have been your host for today. Thank you and good night.